All right, YouTube, it's time to weigh in on the ACA reform, aka Ryan Care at the moment. I'd first, as a disclaimer here, and I said this days ago before this sort of loose framework was even put forth. This is not currently Trump's reform bill. This is a reform bill coming from Republicans in the legislature, namely Paul Ryan, obviously not in tandem with people like Rand Paul, who have refused to support the current deal. And I don't blame them. I don't blame Rand. I don't blame Trump for coming out and thankfully for this. This is a very good idea by Trump. Come in and say, oh yeah, this is malleable. It's not in its final form. Sort of undercutting Paul Ryan. It's funny, Ryan must have cried after that because he wanted his neocon bill, his so-called reform, to go through. In its current form, it's at most half acceptable, which is to say barely better than the ACA itself. It retains basically all the convoluted legalese. The only things that have been added now that make sense are, yeah, there will be competitive drug pricing because you can import from Canada basically. And we're going to kind of lower the cost by encouraging a little bit of interstate competition. Neither of those is a full solution. And additionally, it will retain pre-existing conditions, which is the one thing that most people agreed was good about the ACA. Should have been its own bill, by the way. There never should have been an Affordable Care Act because it's a hideous monstrosity. The rollout was botched. It dispossessed people of plans that they liked that now the government considered junk plans, so that they had to either pay the same amount for less coverage, in many cases, which is defeats the purpose of labeling something as a junk plan, or they had to pay far more for a plan that gives them stuff they don't even really need by arranging them into these tiers, like bronze, silver, and gold plan. Here's the special platinum emerald plan that gives you, helicopter access to the hospital anytime you need it and stuff like that. It was retarded. And the rollout didn't help its public perception either. When people, they have a poll, 51% of Americans don't want the ACA repealed. Yeah, that's because most Americans think Trump intends to literally scrap every aspect of it and overhaul it entirely. That's not what's being suggested. What's being suggested is replacing it with something that is similar in effect, but more effective in lowering costs. I'll say this. If you simply go after lawsuits, drug patents, and interstate competition, you can so vastly lower the price of healthcare in the country that you almost don't even need to supply health insurance to the middle class because it would be well within their reasonable ability to pay for things out of pocket without having to have health insurance. And this is why the Democrats under Obama never bothered with such a reform. Because the pharmaceutical companies that had a major role in crafting the ACA didn't want to lose their monopoly. They didn't want the price of drugs and surgery and stuff to fall, because then people might not purchase health insurance because they won't need it. And it's a monopolistic endeavor. It's a trust, basically. All these companies, they split the country apart with very little competition. They're not going to lower their prices because they don't need to lower the prices on goods and services. It's not a free market situation. People blaming, the far right, evil capitalism, and stuff like that. No, it has nothing to do with that. This is an interventionist system. It's almost centrally planned. It's almost as bad as socialized medicine. That's why it costs so much. It has very few advantages over even outright socialized medicine. It's not that far removed from it. Here's what I suggest, and Trump is alluding to this. You need to take this bill and work it much more thoroughly. Do not accept it in its current form. If you want to blame the Democrats should it not pass, if you want to blame neocons within the party for sabotaging it, you go ahead and attack Paul Ryan and do whatever you need to do. But veto it if it gets to your desk in anything closely resembling its current form. The worst part, and this is pure Paul Ryan, if you have lapsed coverage, we're going to do away with the fine. You don't have to pay the government for not having health insurance, but if you obtain health insurance and lapse in your coverage, you have to pay 30% of the value of the plan that you were on for some time to a private firm. Now, is that constitutional? I'm thinking probably not. I think that even Justice Roberts, who got backed into a corner by Obama and had to declare it constitutional as a tax in the first place, I don't even think he would declare it constitutional to do such a thing. It's a terrible idea. It defeats the purpose. If someone's lapsed in their coverage, is probably a financial reason why. So why would you want to find them and make them pay a private firm, supposedly a private firm, one that's government co-opted at every level, but masquerades as a private firm. Why would you want to pay them a fine? They probably can't afford to pay that fine. What, are you going to throw them in prison for not being able to afford that because that's the reason they lapsed in their coverage in the first place? Oh yeah, I lost my job. I can't afford this plan anymore. I'm working double shift at Wendy's. And then they have to pay through the nose anyway for coverage they're not even getting for some time. That's a retarded idea. It should be completely scrapped. That should be left out of the final bill. It needs more competition. Trump should double down on the idea of interstate competition and relax these patent laws so the cost of these procedures and stuff drops like a rock, and then you won't even have the problem of, certainly the upper middle class wouldn't have a problem paying out of pocket. The middle class, they'd get some junk plan just to help a little bit. Otherwise, they'd pay out of cost because they wouldn't need anything else. Hell, the working class could easily afford to pay out of pocket for basic care under such a situation. Couple it with tort reform, lawsuit reform, hospitals. Some of these doctors that carry $1 million of insurance themselves, medical malpractice insurance. Well, why should they need to do that? These are skilled individuals. They're not, generally speaking, they're not trying to screw anyone, give them substandard care. It's capable, healthcare is capable of being both profitable in a private market and being affordable to the general public if we simply follow the rules of the free market in a general sense. That's what we need. People arguing for more socialism in healthcare don't even understand why it's expensive in the first place. It's expensive because the government meddles in it. It's expensive because the government favors or doesn't favor some firms over others. It allows extensive and complete patents on medical devices, on medicines, and so forth that shouldn't even exist. Those patent laws need total reform. I'd couple that, by the way, with reform of all other copyright laws. There's no reason why copyright laws should protect some song for 70 years plus, whatever else, a duration of the life of the artist or their children's song, books and things like that. It's moronic, honestly. We're robbing ourselves of a great deal of creativity and vastly increasing the prices of some of these things through just the copyright laws themselves. So in its current form, Ryan Care is unpassable. It probably wouldn't pass. A lot of Republicans, including led by Rand, basically, have said, no, we're not going to support this in its current form. It's retarded. I don't blame them. I have to back Rand Paul over people like Paul Ryan on this token. Now, Trump is off to the side. He's executive branch. He's not part of the legislature. He himself didn't have much of an active hand in crafting this. Now he goes, and this is what he's saying. He's going to negotiate with the Democrats and the Republicans. He's going to do deal making to improve the loose framework that's already there. We'll see what results. What comes out of that will be Trump care. It won't be Ryan care anymore. It will be different. How different it is, we have to wait and see. Hopefully it's superior to it. Hopefully he uses his significant intellectual capabilities and those around him. Ben Carson would probably be one of them, even though he's fallen out of favor for comparing slaves to immigration. I'm not even going to bother weighing in on that because, Ben Carson says stuff that's funny all the time. I found it more amusing than difficult to deal with, honestly. But he needs to get some of these other individuals. Rand Paul should be sitting on Trump's lap. He should be there the entire time. Rand is, again, like usual, Rand Paul, the sane man in the room, who simply has an attitude problem and public speaking skills that are somewhat lackluster under pressure, and that's why he ends up screwing himself. But he's a good person, I think. He means well. Not everything he believes in is right, but he's more sane than most people in the Senate or the House, and he should be listened to. If I were Trump, I would pull Rand Paul aside and say, okay, you're staying with me for the next few weeks while we look through this, and don't worry, your concerns will be heard, and you can take it back to the people in Kentucky after that, tell them, yeah, Trump actually listened to you. I would ingratiate myself to Rand Paul if I were in Trump's position, because that's the way to balance the neoconservatism of people like Paul Ryan, who want to protect the pharmaceutical companies. This is where they get a lot of their money from. He's never going to suggest, oh yeah, patent reform might drop the cost of all these devices and drugs. You think he wants that? No, he wants people to have to purchase expensive insurance plans so that these companies continue making record profits, so that they fund lamestream political campaigns like those of Paul Ryan and many of the Democrats. It's people like Rand Paul that get left behind by that. They're not the ones sucking the pharmaceutical cock. Trump didn't. That's why I have hope that he'll actually craft a good idea out of this quasi-monstrosity of Ryan Care. Hopefully he can hammer it out into a better form. But we have to wait and see. People complaining about it now saying, oh, Trump's trying to take my health insurance. Trump didn't design this bill. It was blame the conservatives, blame Paul Ryan. Trump didn't have anything to do with that. For all you know, he will pull Rand Paul aside. Maybe he'll pull Ron Paul in there too, and he'll let them recraft it. We don't know yet. We don't know exactly what his solution is going to be. It's not Trump care. This is Ryan care at the moment. It has to go through several additional steps before it'll even approximate Trump care. But he does need to be careful here, because if he takes this framework and he only modifies it very slightly and he puts it before a vote, it may very well not pass, including among some Republicans. It may alienate people that endorsed him and actually backed him, like Rand Paul, and it'll probably alienate some people who voted for Trump within the general population. He needs to tread carefully on this issue. That would be a bit of political advice to him. Be very careful about putting forth a plan that is essentially just 99% Obamacare anyway. People will not perceive of that as a fix. It won't win you any centrist allies. It won't win you any far left allies. They're going to hate you anyway. And as for Republicans, you will chip away at your own support. From a political perspective, it would be a disaster. You'd probably end up a lame duck in the first year of your first term if you don't tread carefully with what reform you put into place. You run that risk. By simply tackling the issue, you run the risk of making it a deeply partisan issue, reopening sort of that old wound from years ago with the rollout. So hopefully Trump can improve it. And if he improves it at least moderately, it'll be better than the ACA and it will be tolerable. It'll probably need further fixes over time, but at least it'll be solvent. It won't collapse our healthcare industry right away, buying us time to further reform it if the need arises to do so. That's about all.